Indigestion is often a problem of underlying disease like gastroesophageal reflux disease, ulcer or gallbladder disease rather than a disease of its own. Also called dyspepsia, indigestion is usually used to denote a sense of fullness or discomfort in the upper abdomen. Sometimes it's accompanied by a sense of burning or pain in the upper abdomen. The symptoms of indigestion include bloating, that is sometimes called fullness, belching, acidic taste in the mouth, groaning in the stomach, pain in the upper abdomen or discomfort in the upper abdomen. The symptoms sometimes increase at the time of stress. And this indigestion is often accompanied by heartburn. It's a sense of burning deep inside the chest. This heartburn is usually caused by the movement of acids from the stomach into the esophagus. Indigestion is extremely common. In fact, people from all ages and both sexes are affected by it, and individuals' risk increases when there is a disease of the underlying stomach or intestine like ulcer disease, those who consume alcoholic beverages, when there is by some means injury to the stomach like intake of painkillers or aspirin, or at the time of stress or anxiety. Indigestion has many causes, some of which are diseases, some are medications and some are lifestyle factors. The most common disease producing indigestion is gastroesophageal reflux disease, which we commonly call GERD. Apart from this, gastric ulcer or peptic ulcers, gastric infections, irritable bowel syndrome, certain thyroid disorders can produce indigestion. Gastric cancer is a rare cause of indigestion and it's usually not a common cause as we find in our practice. There may be certain medications which are often responsible for indigestion like steroid or other related hormones, analgesics or painkillers, thyroid medications, certain antibiotics. Apart from these two groups, a large majority of people suffer from indigestion due to their bad or unhealthy lifestyle. Factors responsible for this are eating too hurriedly, eating large meal at a time, or just lying down after full stomach, consumption of alcoholic beverages, particularly in the evening hours, smoking, or stress or certain fatigue. These are the factors which are often neglected, but they are quite common, maybe more common than all the diseases or antibiotics taken together. This indigestion is often associated with belching, which is an accompanying features in some of the patients. This belching is usually caused by swallowing excess of air by these patients. And sometimes there is a significant percentage of people who are having indigestion which is quite refractory and are not amenable to any of the factors which are usually apparent in other cases. This group we usually term them as functional indigestion or functional dyspepsia or non-ulcer dyspepsia. Women in their second and third trimester, that is in the middle and last part of pregnancy, often have these indigestion problems, sometimes requiring consultation. They are due to various pregnancy-related factors like relaxation of the muscles of the digestive tract or the effect of pressure from the growing uterus. If you are experiencing indigestion, make it a time to get an appointment with your doctor to rule out more serious conditions, because indigestion is often caused by common disorders, so don't neglect it because some serious underlying condition might produce indigestion. And while describing indigestion to a doctor, it's important that you describe the actual symptom happening, because indigestion is often a vague term. Various people describe or utilize this term to describe different types of symptoms. And it's also important to inform the doctor about the exact location of the symptoms, whether it's upper abdomen or whether it's somewhere else. While evaluating indigestion, the principal job of a physician is to rule out any serious underlying disease. For this, some tests are often necessary. Apart from a few routine blood tests, doctors often prescribe endoscopy. The endoscopy is a device which uses light as well as camera on the tip of a tube that is inserted through the mouth inside the stomach and intestine, to identify disease of those structures which could be responsible for indigestion. Because indigestion is commonly a symptom rather than a disease, so the treatment of indigestion basically depends on the underlying disease the person has. And before going to the doctor, some patients usually have indigestion episodes go away within hours, sometimes even without medications. But those who are really bothered by troublesome indigestion should consult a doctor and should follow some healthy lifestyle practices, like they should stop eating too hurriedly or eating heavy meal, or should stop getting water while meal. They should take it a significant time after the meal. They should chew food properly, should chew foods with closed mouth, should avoid alcoholic beverages, stop smoking, and must cut down their level of stress. The best way to prevent indigestion is to avoid foods or lifestyle factors that precipitate indigestion. Particularly for this, keeping a food diary is worthwhile and sometimes is of great benefit. However, there are some common advices which usually doctors prescribe, like eat in small quantity, eat slowly, avoid citrus fruits, particularly in the evening or night, avoid alcoholic beverages, and smokers should consider quitting smoking. Alcoholics should cut down their alcohol intake. Those who are suffering from indigestion should not wear tight-fitting clothes. They should not go to the bed immediately after a meal, or they should not even exercise with a full stomach, or do not lie down immediately after a meal. And they must wait at least for 2 to 3 hours to go to the bed after the last meal. Raising the head end of the bed at bedtime is of most notable benefit, and this should be achieved by keeping blocks beneath the bed at the head end rather than putting piles of pillows under the head, because keeping blocks beneath the bed will raise both the head and chest from the abdomen. That is beneficial to prevent reflux. Only by keeping pillows below the head will make an acute angle between head and chest, and that will further aggravate the indigestion or reflux disease. Because indigestion could rarely be a symptoms of more severe underlying disease. Sometimes you need to consult your doctor, particularly when one has bleeding from the mouth or vomiting, when one has black tarry stool or frank blood in the stool, when there is unintentional weight loss or significant loss of appetite or significant pain in the upper or lower abdomen. Very, very rarely, however, indigestion could mimic a cardiac disease or cardiac attack, particularly when the indigestion is severe, not responding to routine medications, because indigestion could rarely be a sign of underlying serious disease. So call your doctor if you have any of the symptoms like vomiting or blood coming out in vomiting, unintentional weight loss, significant loss of appetite, black tarry stool or frank blood in the stool, pain in the upper abdomen or elsewhere which is severe and significant. Very, very rarely, however, indigestion could mimic cardiac disease or heart attack, particularly when the indigestion is troublesome, not responsive to routine medications, associated with shortness of breath, chest pain or pain radiating in the arms, neck, in the back. Then one need to consult and rule out a cardiac disorder. First, to reflux of gastric contents into the esophagus. In normal digestion, what happens? The esophageal contents pass through the lower esophageal sphincter into the stomach, and then the lower esophageal sphincter closes and the contents cannot come back into esophagus. But in gastroesophageal reflux, this lower esophageal sphincter is weak or it functions inappropriately, resulting in the reflux of the gastric or the stomach contents into the esophagus. The severity of gastroesophageal reflux depends on the competence or incompetence rather of this lower esophageal sphincter, the amount and type of the material brought up from the stomach, and the neutralizing effect of saliva. Hiatal hernia occurs when the part of stomach, that is upper part of stomach, moves up into the chest through an opening in the diaphragm. Some doctors believe that hiatal hernia is responsible for reflux because it weakens the muscles of the lower esophagus, that is lower esophageal sphincter. Now, hiatal hernia is quite common, though its Prevalence increases with increasing age, particularly above the age of 50 years. People of all ages and both sexes are equally susceptible to have hiatus hernia. Not necessarily all patients of reflux will have hiatus hernia, and on the other hand, hiatus hernia person with hiatus hernia may not have a reflux disease. But still there is a strong correlation between the presence of hiatus hernia and the presence or the severity of reflux symptoms. Most of the hiatal hernias do not need treatment. If reflux symptoms is present, that needs treatment or counseling. However, if the hernia is quite large, at the risk of being strangulated or associated with refractory or severe reflux disease, doctors often perform surgery to reduce the size of the hernia. Dietary and lifestyle factors contribute to GERD. Certain foods and beverages like coffee, alcohol, tobacco, chocolate, peppermint can exacerbate heartburn. Studies have shown that cigarette smoking also decreases the pressure of the lower esophageal sphincter. Pregnancy and obesity also have detrimental effect on the reflux disease. Heartburn, also called acid indigestion, is the most common symptom of GERD. It feels like a burning pain behind the breastbone that moves up. Some people sometimes complain that they have fluid coming in the mouth that often tastes sour or bitter. The burning pressure or pain, whatever may be the symptom described by the patient, usually lasts for nearly 2 hours. It's more after a full stomach. It increases after lying down or bending forward, and people sometimes get relief by standing, making their body straight, or taking antacids. Sometimes these heartburn symptoms are confusing because they might mimic the heart attack. However, there are notable differences. The chest pain of heart attack usually is aggravated by exercise. However, heartburn symptoms have no relation with activities